Hi there, welcome to the Clinical Supervision Hub. I'm Dr. Asha Patel, clinical psychologist and founder of Innovating Minds and the Clinical Supervision Hub. I think it's really important to think about the difference between line management and clinical supervision, but also to think about a model that's going to suit you and your organisation, to embed a culture around clinical supervision, and particularly if you're working towards becoming a trauma-informed organisation, of how supervision can support you with doing that. The line management supervision is typically conducted by line management, a senior member of staff within your organisation, and the conversations are linked to job descriptions, performance-related discussions, and are target-driven. They do take place, whether it's frequency in terms of termly or annually, and within those sessions you might discuss training needs, and depending on the nature of the supervisor, also be thinking about the staff mental health and well-being. Whereas clinical supervision is generally provided by an external supervisor, and a good supervisor is generally a clinician that has experience within the sector that you're working with, and also qualifications that enable them to deliver supervision, whether that's to professionals, qualified professionals, or frontline practitioners that are not clinically trained, but are working with really vulnerable people within the community. Now, clinical supervision enables a space to be created, this safe space that reflective practice can take place. And what happens within supervision sessions is that the supervisees, so your team members, bring different agenda items, and it's a supervisor's job to keep that safe space, but also to elicit reflective feedback to take place, and that process of reflection using a solution-focused approach. So these are not moaning sessions, these are not sessions where HR issues are discussed and resolved. This is very much focusing upon the work that they're doing, eliciting support, whether it's through their peer support, through the clinical supervisor, for them to be able to think about their work that they're doing, reflect upon the impact that might be having on their mental health and well-being. And they also might want to use those sessions to think about risk management. In terms of the frequency of those sessions, they take place on average every 4 to 6 weeks, but we'll work with you to identify how frequent is suitable for your organisation and the needs of your staff that you're working with. Supervision can take place on a one-to-one and or group basis. Groups are on average 3 people per group, and one-to-one sessions can take place for line managers, or it might be that line managers want to refer their staff members for one-to-one sessions if there's a particular incident that's taken place and that individual would benefit from one-to-one sessions. Again, we can work with you to identify how many groups and one-to-one sessions that your organisation may need. Clinical supervision enables that personal and professional development to take place. It also enables people to develop their psychological mindedness, so they can start reflecting upon their work, the impact that it's having, but also maybe reflect upon any biases that might be taking place. A supervisor will also be introducing learning resources and suggesting models and additional reading that they might want to have a look at to further develop their professional knowledge. We're using evidence-based approaches, so the models of clinical supervision offered by us are evidence-based, and the supervisors have experience within the sector that you're working with, and we ensure that a good matching process takes place so that a supervisor is able to meet the needs of your team members. The other benefit, of course, for clinical supervision hub is vicarious trauma, and this is the cost of caring, because the nature of the work that you and your colleagues are doing will have an impact on their mental health and well-being. And this is not because they're not good at their job. This is not because they're not experienced in any way. This is because they have empathic relationships. They care about the people that you're working with. Indirectly, they will be traumatized. The nature of the information that they're hearing and seeing will have an impact on them. If this information isn't processed, whether it's through supervision or through any form of support, what happens is indirectly this trauma is processed through the body. So if you're on your journey to becoming a trauma-informed organisation, you're really invested in your staff well-being and mental health, supervision is practice that you can put in place to be able to support your staff's personal and professional development and their mental health and well-being. Cost of caring is real, and it's really important that we acknowledge that the impact that can have on your staff. Clinical supervision is a culture, and when it works really well, it's a culture that's embedded within your organisation. You can use models such as an opt-in approach. So if you're just new to the journey, maybe not a lot of your staff members have access to clinical supervision. An opt-in model enables your staff to gradually come on board, start to feel comfortable with engaging clinical supervision, which means that resources are well used. If you've got any questions about the Clinical Supervision Hub or are interested in exploring more, please don't hesitate to reach out to a member of our team. We'll be happy to support you in building your package around clinical supervision, supporting you and your organisation.